Thank you for giving me this chance to share everybody with what's going on patient safety in Taiwan. So I will share with you the progress and something we are right now doing in Taiwan. Okay, so first slide, I like to show you the iconic building of Taiwan, which is a Bao'an Palace Temple.
Recording in progress.
Yeah, in Taiwan. This is a very symbolic building in Taiwan. It's an Asian Pacific heritage because Baoshan is a god of medicine. So in the old times, when pandemic hit Taiwan and China, the god of medicine helped the people to save their lives. So this can reflect some pandemic history in our time. So we choose this as an ionic building for the Patient Safety Day. And the next, I would like to show you that in Taiwan, we have our national healthcare quality and the patient safety goals every year. And we will revise that every 2 years. So we have launched the new patient safety goals early this year. Largely is to improve the resilience because right now, after the pandemic, resilience is very important, especially in Taiwan. We are facing a very serious problem of manpower shortage. And although to handle with emerging infection is also very important. Will keep very, very important in the future for any COVID-like infection coming again. And although in Taiwan, I will talk to you later because in Taiwan, even though the healthcare is quite advanced and we have the universal coverage of the healthcare, but the birth rate is very low. It's among the lowest in the world. But we have some maternal and children health issue. So the most important things in Taiwan right now, in this year and the coming few years, I think the most important thing is to secure the maternal and the child safety. We launched a big campaign called Together We Care. So we want to improve the pregnancy and delivery safety by launching a lot of bundle care brochure and to improve the peri-maternal health examination. And also, we are introducing the human factor analysis and the classification system into our root cause analysis education and clinical practice because we have done a lot of root cause analysis education, but we feel that it is more important to find out the human factors underlying all the medical adverse events. So we launched a nationwide program to educate the personnel from hospitals to use HFACS to do the checklist when they do the root cause analysis. And it's a very important thing regarding the patient safety in Taiwan is the implementation of we call the Medical Adverse Event Dispute Resolution Act. So there are several key elements of this act. First things is to when the things happen, we need to reconciliate. We need to communicate with the patient and the families, and the government has assigned the institution to do the work. And although for some very severe medical adverse event, like the severe injury or death of the medical adverse event, they need to report to the government. And within the health facility, they need to do the root cause analysis and also the quality improvement. So this is a major step of the patient safety in Taiwan. So I can say that this Dispute Resolution Act is actually a patient safety act in Taiwan that was formally launched January 1st, 2024. And although recently, nationwide, we have noticed because of the more use of the smart health care, that is the IT technology, we found that more and more medical events are related to the use of a computer with the use of a medical device and the use of the IT technology. So we launched a program that encouraged the hospital to report the information technology related patient safety issue, not limited to the cybersecurity, but also other problem that computation error, system interface problem, and the Wi-Fi cover problem, so far and so on. So we are now collecting data and hopefully to share with you in this year's ISQA in Turkey. And also, the fire, is a very important issue in Taiwan. So we work with the Australian ACHSI to work on the project called the SHEAP, that is Environmental Safety Advisory Program. That we will have some experts to inspect the facility environment to help them to prevent the fire from the software part. And although we in Taiwan, we use a computer simulation to help the hemodialysis centers to reorganize their fire prevention plan, use a simulation technology to help them to modify their emergency evacuation plan. So this project is going on nationwide. Okay, so thank you very much. This is about something about the patient safety operation happen in Taiwan. Thank you.